Hi ladies, welcome back to the Holistic Approach, where we discuss how your physical, mental, spiritual, and emotional health are interconnected and play a vital role in your overall well-being. My name is Funke, also known as the Curvy Nurse, and I am an RN BSN and a certified health educator. I know a lot of us weren't properly introduced or taught about a very natural occurring cycle in our womanhood called the menstrual cycle. A lot of the times we learn incorrect or insufficient information from our friends, parents, teachers, and even healthcare providers. And oftentimes we dread even talking about our cycles because it's either taboo or just overall embarrassing to talk about. Because for the most part, we know that we bleed every month, but do you really know what's going on? Today we're going to talk about that. We're going to talk about what the menstrual cycle is and what really occurs during the cycle. So stay tuned. Before we start, don't forget to subscribe to my channel so you can get more information about health, beauty, lifestyle, and entrepreneurship. And don't forget to hit that notification bell so you can be alerted every time I upload a new video. So let's get started. So what exactly is the menstrual cycle and what really goes on? Well, the menstrual cycle is a monthly cycle of changes that occurs in a female's reproductive system to prepare her for pregnancy. If she doesn't become pregnant, that's when she sheds the lining in her uterus, also known as the endometrial lining. She releases this blood from her uterus through her vaginal canal. Your cycle starts from day 1 of one cycle till day 1 of the following cycle. It typically lasts 28 days, but it can be more or less. Some people's cycle ranges from anywhere from 21 to 35 days. So the menstrual cycle consists of 2 phases, the ovarian phase and the uterine phase. So these 2 phases occur separately but simultaneously. That means your ovaries and your uterus go through different processes, but they occur at the same time. So we're going to begin with the first phase of the ovarian cycle. We'll see that the different phases in the ovarian phase and the phases of the uterine phase, they coincide. In the ovary phase, there are 3 phases, and in the uterine phase, there are also 3 phases. So the first phase of the ovary phase is called the follicular phase. That occurs on cycle days 1 through 14. During this phase, hormones that are controlled by your brain send signals to your ovaries to release a matured egg that is ready to be fertilized and implanted in your uterus. This phase coincides with the menstrual phase and the proliferative phase of the uterine phases. Please also keep in mind that during this follicular phase, your most fertile days are from day 9 of your cycle up until 24 hours after the ovarian phase. So the window from cycle day 9 up until cycle day 15 are your most fertile days. Well, as I mentioned before, the follicular phase occurs simultaneously with the menstrual phase and the proliferative phase. So during the menstrual phase, which typically occurs on cycle days 1 through 6, this is where you're going to be shedding the endometrial lining of your uterus because you didn't get pregnant in the previous cycle. During the proliferative phase, which is cycle days 7 through 14, this is where the endometrial lining is being rebuilt just in case an egg is fertilized and it's ready for implantation. This is also where the cervical mucus in your body begins to thin out so it can make the environment more sperm friendly so that pregnancy can occur. Also, let me let you in on a fact. Sperm can live in your reproductive tract for up to 5 days. So please be careful out there, ladies, when you're having unprotected sex. After cycle day 15, which is after your ovulation day, that's when the cervical mucus begins to thicken and it makes the environment less sperm friendly, which causes the chances of fertilization to decrease. So the more thick your cervical mucus is, the less sperm friendly it becomes, and it decreases your chances of fertilization to occur. The ovulation phase is the next phase of the ovarian phase, which occurs on cycle day 14. This is where the egg from your ovaries is released into the fallopian tube. Last but not least, we have the luteal phase of the ovarian phase, which occurs on cycle days 15 to 28. If pregnancy does not occur, the cycle starts all over again and prepares itself for day 1 of the next menstrual cycle. This coincides with the last phase of the uterine cycle, which is the secretory phase of the uterine cycle. This also occurs on cycle days 15 to 28. This is where the endometrium of the uterus becomes receptive to the fertilized egg, so pregnancy can occur. If pregnancy does not occur, the cycle starts all over again to day 1 of the next menstrual cycle. Now that we went through the process of what actually occurs during the menstrual cycle, let's talk about what is the menstrual cycle. So the menstrual cycle starts with your first menses, which is called the menarche, and it occurs in young adolescent females, typically around the age, on average, around the age of 12. Can come before or after, depends, everybody's different. During the first few years of your menstrual cycle, you could possibly experience longer cycles. However, they do shorten and regulate over time as you get older. The menstrual cycle is counted from the first day of one cycle to the first day of the next cycle. It typically, on average, is 28 days, but it can range from 21 to 35 days, and it can last from 3 to 7 days. It depends, every woman varies. It is common for your cycle to be regular, occurring at the same time and length, or somewhat irregular. And your periods can be light, heavy, short or long, painful or pain-free. This menstrual cycle occurs on a monthly basis up until menopause. The only time it pauses is during pregnancy, or if you have some type of reproductive illness or ailment that makes your periods irregular. Menopause is when your ovarian cycle stops and declines, which basically means you stop producing eggs. It typically occurs during the ages of 45 to 55, but it can occur as early as 30 and as late as 60 years old. So what are some causes of menstrual cycle irregularities? Well, for starters, we have pregnancy and breastfeeding. So if you're pregnant, you're not going to menstruate. Breastfeeding is known to delay when your menstrual cycle comes back. Eating disorders such as anorexia, extreme weight loss, or excessively exercising can also cause irregularities in your menstrual cycle. Endometriosis, menopause, premature ovarian failure, which is where you lose the functions of your ovaries before the age of 40, and uterine fibroids, which can cause heavy, prolonged, and painful menstrual periods. Okay, so now that we know what occurs during the menstrual cycle, let's learn how we can track our cycles. Keeping track of your cycle is beneficial because it'll alert you when something suddenly changes, and it can also let you know when your period is late. You can easily keep track of your cycle with the use of period tracking apps. When using these apps, please keep in mind that you should regularly update the app. Most period tracking apps require you to input information. It can best generate your ovulation date, your fertile window, and when your next period is to begin. The more you input information and track your cycle, the more accurate it becomes. I also like these apps because they allow you to keep track of your symptoms that you're experiencing before, during, and after your cycle. And this is beneficial because you can prepare for your next cycle because you'll know what typically occurs every month. Please note that a period tracking app can be incorrect, especially if you have irregular periods. So let's start with the apps that I would recommend. The first one is Clue. This app helps you learn and keep track of everything going on in your body during your period. It helps you predict possible changes in your body, from period-induced breakouts to PMS headaches, that you can monitor all on your smartphone. Flow. Flow is a popular all-in-one period tracker that gives you a helpful overview of your body with daily health insights and a virtual health assistant. This app can also be transformed into a period tracker if needed. Eve by Glow. This is an app that keeps track of your weight, your exercise and activity habits, and your sex life. This app gives you information you need when it comes to sexual health for women. This is the app that I've personally used for the past couple of years because it is easy and simple. And I also enjoy that I get to chat it up with other women about so many relatable topics in the community forums. Ovia. Now, this is an app that caters to women who are trying to get pregnant. Ovia is a fertility tracker that shows you the best time to get pregnant. It also helps you track your basal temperature, your cervical position, and your cervical mucus. This app will guide you through your pregnancy all the way to parenthood. It can also be used as a period tracker. So I would like to know, how do you keep track of your menstrual cycle? Leave a comment down below and let's discuss. So ladies, that concludes the first video of the Women's Cycle series that I will be uploading on YouTube. And please remember, ladies, that we should not feel embarrassed or ashamed to talk about our bodies and the natural cycles that it goes through. And make sure you're getting your information from a trusted source that can explain and articulate the information to you. If you haven't already subscribed to my channel, please do. And don't forget to hit that notification bell so you can be notified when I upload my next video. You can look forward to new content on this channel once a week. And last but not least, stay tuned for next week's video where we talk about period health, where I will be discussing top name brand period product companies and how their period products are causing harm to our reproductive organs. I will also be sharing alternative period products that are 100% organic and are natural for our vaginas. So until then, thank you for watching, and I'll see you at your next holistic health appointment. Bye.